After air passes through the nasal cavity, it next moves into the pharynx. Yes, I said pharynx. You don't have a pharynx. So the pharynx is what we commonly call the throat, and it's a funnel-shaped tube about 5 inches long. It starts at the internal nares and extends to the level of the cricoid cartilage, which is going to be the inferior-most cartilage of the larynx that we'll see in just a few minutes. So the pharynx is posterior to the nasal and oral cavities. It is superior to the larynx and anterior to the cervical vertebrae. How's that for using a bunch of A&P terminology? The wall is composed of skeletal muscles and lined with a mucous membrane, so when those skeletal muscles contract, it helps us with swallowing. The pharynx functions as a passageway for both air and food. It also provides a resonating chamber that helps to change or alter our sounds for speech, and it houses some of our tonsils, which are going to be a part of our immune response. So these tonsils are located in strategic areas to help prevent foreign invaders from getting in. Anatomically, we can divide the pharynx into 3 regions: the nasopharynx, which is behind the nasal cavity, the oropharynx, which is behind the oral cavity, and the laryngeal pharynx, which is going to extend down to where the larynx is going to begin. In the posterior wall of the nasopharynx, we have the pharyngeal tonsils. We call those adenoids most of the time. Through the internal nares, the nasopharynx receives air from the nasal cavity along with a lot of dirty, trash-filled mucus. Think about when you're breathing. You've got the mucous membrane lining your nasal cavity. We're breathing in dust and dead cells and pollutants and pollen, so all of that gets trapped in that mucus. And because the nasopharynx is lined with ciliated pseudocolumnar epithelial cells, the cilia is going to help to move that mucus down toward the inferior part of the pharynx, and we swallow that along with the saliva and basically just never know all that nastiness was there. The nasopharynx also is going to exchange small amounts of air with the auditory or eustachian tubes, and that helps to equalize pressure between the middle ear and the atmosphere. So this is why when your ears pop if you are going uphill, or when you're swallowing, or when you're in a plane, that popping allows the ears, the middle ear gases that get trapped in there to be removed through the nasopharynx. So the intermediate or the middle part of the pharynx is the oropharynx, and it's just posterior to the oral cavity, and it extends from the soft palate to the level of the hyoid bone. This part of the pharynx has both respiratory and digestive functions because it's a common passageway for air that we breathe and food and drink that we eat and consume as beverages. So because this part of the pharynx is always being has a lot of friction on it, or gets a lot of abrasion by the food that we eat, it's lined with non-keratinized stratified squamous epithelial cells, so the mitosis rate is very rapid and these cells are constantly being replaced. In the oropharynx, we also have 2 other pair of tonsils, and that's our palatine tonsils that are associated with the hard palate, and the lingual tonsils that are on the base of the tongue. Again, the adenoids, the palatine and the lingual tonsils, are all going to be a part of the immune system. So hopefully you learned about this in your study of the immune system. But these are located strategically so that they can help to remove pathogens that get brought into the body through the nasal and the oral cavity. The bottom part of the pharynx is the laryngeal pharynx, and it begins at the hyoid bone. At its inferior end, it opens into the esophagus or food tube on the posterior aspect and opens to the larynx or the voice box anterior. Like the oropharynx, the laryngeal pharynx is both respiratory and digestive, and it's lined with non-keratinized stratified squamous epithelial cells. The larynx, yes, again, it's larynx, not larynx. The larynx is what we normally just call the voice box, and it's a short passageway that connects the laryngeal pharynx with the trachea. So it lies at the midline of the neck, anterior to the esophagus, and about the area of the 4th through the 6th cervical vertebrae. The walls of the larynx are composed of 9 pieces of cartilage. The arytenoid cartilages are the most important because they influence changes in position and therefore the tension of the vocal folds that we use to produce speech. The thyroid cartilage consists of two fused plates of hyaline cartilage that form the anterior wall of the larynx and give it its triangular shape. So here you can see that large thyroid cartilage. Right here you've got a posterior view, and you can see a little bit of the arytenoid cartilage that's going to attach to your vocal cords. We'll see this again in just a moment. Alright, so we've got the thyroid cartilage. That's what we commonly call the Adam's apple. It becomes larger in the male due to the influence of the androgens, or the male hormones, during the time of active growth during puberty. You can also see here the epiglottis. Now remember, we're looking at a posterior view. Okay, so within right here, this area is going to be the open part. Okay, so these C-shaped cartilaginous rings are going to hold the trachea open, but up here at the very superior part, all of this is open as well. So the epiglottis is a very large, sort of leaf-shaped piece of cartilage that's covered with epithelial tissues, and it moves up and down very much like a trap excuse me, very much like a trap door. So when we're swallowing, the pharynx widens to receive the food or the drink, whatever we're swallowing, and that causes the epiglottis to move down, and it forms a lid over the glottis, closing it off. So I just mentioned the glottis. Let's change now and look at an image that you can see what I was talking about. So the glottis is actually the vocal folds, the vestibular folds, which are made of a membrane, and the opening between the vocal folds that's called the rhimaglottis. So when this is closed off because of the trachea, because of the epiglottis folding down over it, but also the muscles pulling and closing that, those two actions, the epiglottis and the closing of the glottis, prevents food and beverages from getting down into the lower parts of the respiratory passageways. Now, think about what happens when you breathe in a small particle of dust or smoke, or if someone startles you as you're drinking your beverage or you're chewing your food and you get a little piece of something into the larynx. That cough reflex occurs, and that usually is able to help us to move whatever we swallowed that wasn't supposed to be there and get rid of it into the pharynx so it can be swallowed. In addition to the two cartilages that we've seen already, which were your cricoid cartilage making up your Adam's apple and your epiglottis, which is forming that flap, let's look also at the cricoid cartilage. So the cricoid cartilage, you can see here, I'm sorry, I pointed that out a while ago and I should have been showing you the big thyroid cartilage. Your cricoid cartilage is going to be a landmark that can be used if you need to perform a tracheotomy, because here you've got your nice large thyroid cartilage, here's your cricoid cartilage. Between the two you have the cricothyroid ligament, so you feel for that piece of soft tissue, and that would be the place to make that emergency opening if you needed to do a tracheotomy. Now hopefully you're not going to need to do that anytime soon, but good information, right? And the last thing we want to talk about with the larynx is the lining of the larynx. If it is inferior to the vocal folds or below the vocal folds, it's ciliated, pseudostratified columnar epithelial that has a whole lot of goblet cells, and of course with the ciliated columnar cells. So the mucus that's going to be produced by all those goblet cells is going to help to trap dust and other debris and pollen and such that's not trapped and removed from the upper respiratory passages. So this stuff makes it a little bit farther down. Then the mucus traps it in the cilia, and the upper respiratory tract are going to move that mucus and all the trapped particles down toward the pharynx, and the cilia in the lower respiratory tract are going to move them up toward the pharynx. So those two cilia in the upper respiratory tract moving things down, in the lower respiratory tract moving things up, that two sets of ciliated columnar epithelial cells helping us to move things that get into the respiratory tract. So one additional thing, I'm sorry, that we've got to cover before we move the larynx, because the larynx is the voice box. It's pretty important we talk a little bit about that function, right? So the vocal folds that you just saw are the main structures of voice production. So the laryngeal muscles attach to the cartilage and to the vocal folds, and when the muscles contract, they move the cartilage. That stretches the vocal folds in the airways so that the glottis is narrowed. Contracting and relaxing the muscles varies the tension in the vocal folds, sort of like if you're loosening or tightening a guitar string. Then air passing through the larynx vibrates the fold and produces sound by setting up sound waves in the column of air in the pharynx, the nose, and the mouth. The variation in the pitch of the sound is related to the tension of the vocal folds. So the greater the pressure of air, the louder the sound that's going to be produced by those vibrating folds. So sound originates from the vibration of the vocal folds, but there are other structures that play a very important role in converting that sound into something that's recognizable speech. The pharynx, the mouth, the nasal cavity, the paranasal sinuses all act as resonating chambers that give the voice its human and individual qualities. We produce vowel sounds by constricting and relaxing the muscles in the wall of the pharynx. The muscles of the face, the tongue, and the lips help us to enunciate words. So let's finish the larynx with a clinical connection, and that is laryngitis and cancer of the pharynx. So laryngitis, anytime you see itis, think inflammation. Larynge, of course, that's the larynx. So laryngitis is simply an inflammation of the larynx, and it's most commonly caused by a respiratory infection or irritants such as cigarette smoke or breathing in some type of chemical fumes. So the inflammation of the vocal folds cause our voice to sound hoarse, or we can lose our voice by interfering with the contraction of the folds or causing them to swell where they can't vibrate as they normally would. Many long-term smokers acquire a permanent hoarseness because of the damage done by that chronic inflammation. Cancer of the larynx is almost always in individuals who smoke. The condition is characterized by hoarseness, pain on swallowing, pain radiating out to the ear, and treatment for cancer of the larynx usually is going to consist of surgery and or radiation therapy.